There we go. With no further ado, over to you, Richard.
No, thank you so much, Adam, and thank you, everyone, for coming into this breakout room to see my talk. What an excellent keynote to start off with. So, my name is Richard Simpson, and I'm a PhD candidate. In the last few months or so of finishing off my PhD. I'm also a lecturer at Leeds Beckett, Leeds Trinity, and the Open University, respectively. So I'm here, there, and everywhere at the moment. But today I'm delighted to present some of my work on psychological well-being and close sport relationships, which forms a little bit of a part of my PhD. So we're really going to be exploring the wonders of we today and seeing why the benefits of moving beyond individual lenses of well-being in sports. Just briefly, before we start, I just want to give a few brief special mentions to my colleagues, my mentors and supervisors, two of the best researchers I've worked with, in Dr. Faye Didymus and Dr. Tony Williams, who have supported me in this work. My details are below just in case we don't get a chance to have ask questions or have a chat beyond this presentation. I'm more than happy to have conversations in particular about this work and what it offers. So to begin with, and I always pitch this question in regards to thinking about, okay, so where is there a need? Where is there a rationale for interpersonal perspectives of psychological well-being in sport? And it really started off in my journey when I was considering how, through a systematic review in my early pieces of my work, how organizational stress and well-being within sport organizations has typically been examined. And from my work, we've started to notice that really there is a sense of a myth of individualism, in the sense that when we consider concepts such as psychological stress, organizational stress, and also well-being within sport organizations and among key close and work relationships, that is very much an individual lens. And it's really perpetuating the sense that quite often that mental health and well-being is fixed within an individual. But what's very apparent from the work that I've conducted, from my systematic review, and from many other pieces of evidence out there, is that the factors and the kind of antecedents that can typically influence our well-being are other people. There are close relationships with others. There are relationships with the coach, relationship with parents, as Camilla outlined. And so really it starts to beg the question, why are we still focused on the individual? So it's really got me started thinking, and again, for those of you who have watched The Last Dance, as I'm sure quite a few of us may have, it really kind of strikes me when I think about this quote by Phil Jackson, the idea that good teams can become great ones when the members trust each other enough to surrender the me for the we. And that quote really has kind of helped me to embark on this line of inquiry, which I'll outline a little bit later, to understanding how well-being is collectively experienced, to understanding how well-being is kind of considered as good in its own terms among key relationships. And the reason that I think kind of this is really important is when we consider perceptions of well-being, the idea that we're often quite fixed on the individual, we understand that often, as I've mentioned, they're focused on individual experiences. But when we come to actually support well-being or think about how we can manage and protect it and shield it, is very much interpersonal in nature. It's interactive in nature. So it begs the question, if we're wanting to support well-being, why are we necessarily always still focused on just on the individual? As vital part as it does play, is there a gap there in the fact that we support well-being through an interpersonal nature, but often perceptions and investigations and kind of cited experiences of well-being are often captured through individual lenses? So really, again, it's something to ponder, and it's something that has really kind of inspired me in my work to explore well-being through a range of close sport relationships. And today I'm going to kind of share a little bit of some of my work, which has looked at psychological well-being within the coach, athlete, sports psychology practitioner triad, with hopefully some implications for understanding other combinations of work potentially as well. So in terms of the importance of examining well-being in sport, I think a lot of us invested within the realms of sport, we know how important it is, and really how important it always has been. If you've again heard of the writings of Aristotle, who's kind of talked about the idea of a good life. It also dates further back to that. I was reading a history book really the other day and looking at kind of Egyptology, understanding also from other cultures, the Maori, for example, and understanding that they have their own kind of lenses and understanding of what makes a good life, and why well-being in all its different sense of terms and terminology is really important. This is no different within sports. It is very much more so nowadays a growing focal point within sport policy. For example, we've had the White Report, in particular with a lens on gymnastics. We've had the Duty of Care report, Tanni Gray-Thompson. And so really work in our area has been starting to acknowledge the importance of redefining what sustained success looks like. What does a long win, as Kath Bishop mentioned, look like? Because it's important to do this. We know that elite sport environments are volatile and precarious. There's a range of personal, organizational, and competitive stresses that can lead to, optimistically, sometimes growth, but more so lead to health and performance consequences. But we also know that, as well as these consequences, we know that there's potential within the idea of competitive sport to be an arena for positive emotions, to help people finding a sense of meaning and purpose, and to allow people to individually and collectively flourish between coaches and athletes and performers of kind of different types of roles and demographics and so on and so forth. Sport itself is an arena where people can experience a good life. And for me, what's really interested me is kind of amongst all the kind of stories we hear about competitive sport, about where it's very much not experienced as a good life, with the real importance of putting well-being at the front and center of everything we do in sports. So it then comes to the real kind of complexity of characterizing well-being among sport performers, and it really is a minefield. And in terms of trying to get to the heart of it, it can be pretty difficult for those coaches out there who are trying to really understand how to support well-being and also to understand it. If you're getting confused, you're not the only ones. Researchers have been kind of really struggling with this for decades upon decades, especially within the sport context. These are just a few examples, really, that there's a few conceptual kind of tools, I like to call them, in which have been typically used to understand well-being in sport. You have the idea of eudaimonia, and again, I've synthesized this to understanding how one functions and if they're functioning well. We have hedonia, the idea of kind of typically feeling well. And those have been the two main pillars for understanding psychological well-being within the sport context. I've highlighted psychological richness here, and this hasn't really been examined within the sport context, but for me, it's important to really outline that there's so many different dimensions of well-being that exist. And so it then begs the question of what makes an essence of well-being. What is well-being then? Do we need a full, complete picture of all the different dimensions of well-being? And so really this has led to kind of challenges in conceptualizing well-being, into understanding well-being, and then also, as I mentioned in my first slide or two, into supporting well-being. So we know there's many dimensions that exist of well-being out there. But in particular, for me, the approach that I'm starting to take in my PhD is I'm not looking for a holy grail definition of well-being within individuals or within close sport relationships. The work that I'm currently on at the moment, we're looking to co-produce understandings of well-being. We're looking to engineer understandings of well-being over time. There isn't going to be a definition of well-being that maintains the course, and nor should there be. And so really the importance of giving power more so to the participants we work with to define their well-being, whilst we as researchers are the guide, is becoming increasingly more important. So the case more so for interpersonal well-being, building on previous slides, is the idea that amongst athletes, amongst coaches and support staff, there's a range of different a range of evidence that exists to understanding the importance of interpersonal aspects of well-being, from Louise Davis and Sophia Jowett's work, who's looked at the ways in which interpersonal conflict influences hedonic well-being. We know very well that on individual levels that we've got relationships and also kind of isolation can be factors that influence individual levels of well-being. Among coaches, the ideas of workload, the ideas of kind of well-being being influenced by the coach-athlete relationship are really well renowned out there. Amongst support staff, in particular sports psychology practitioners, we've got plenty of work that is starting to grow in number that investigates coping, social support, self-care experiences, professional quality of life. So we're really starting to see, in almost in its different individual silos, the kind of indirect and direct importance of well-being. And we know that recent work is pointing to the influence of close sport relationships, and really the importance of both dyads and triads. Within this instance, triads being really important for understanding how conflict can be managed, how coaches can support and feel supported, and then also the role of the triad in minimizing athlete burnout. So really promotes the importance of understanding well-being amongst close sport relationships. And in this context, in my work, we look at well-being amongst the coach, athlete, practitioner triad. This, despite contributions, as I mentioned, that's looked at individual well-being, little is known about well-being, not only more generally amongst close personal relationships and broader psychology, but in particular in this context among close sport relationships, which kind of sets up the need for our work. So the aim of this paper, which is which is now published in Psychology of Sport and Exercise, was to explore the antecedents, transfer mechanisms, and outcomes of interpersonal psychological well-being within the coach, athlete, sports psychology practitioner triad. Really, I'll keep this very short from a researcher's perspective, but as a qualitative researcher, underpinned by an interpretative paradigm, I used individual and triadic interviews to collect data on well-being. So also as a way to almost manage power dynamics, the individual interviews gave a space for people to talk about well-being they experience within their triad and feel safe to do so, whilst also then having the opportunity to interact with members of their triad within a triadic interview. So these interviews were then analysed through a thematic analysis to look for kind of common themes and patterns among the triad. And then we also, again, to kind of assess the quality of the work, we look to kind of draw on critical friends, on member reflections, and so on and so forth to enhance the rigor of the work in particular. So starting off with some antecedents of well-being. So some factors that influence well-being within the coach, athlete, practitioner triad. I don't have time to go through all of them, but I'll go through one example each of these categories per se. So interestingly, whilst this hasn't really been a feature of previous work in looking at interpersonal resilience, whilst a lot of things have looked at kind of team resilience, for example, importance was placed within these interviews, both individual and triadic interviews, of how all members of the triad, as mentioned by this dialogue here, navigated adversity and change through an Olympic cycle, which in turn enhanced eudaimonic dimensions of well-being in particular. As this quote clearly shows, the idea about an athlete having a halo 100% of the time and how much resilience this can often take. But those have been challenges that the athlete have leaned on the practitioner and also the coach in order to kind of deal with and to grow a sense of resilience amongst the triad who are going through these challenges together in turn becoming more quit over time. So these are just, again, one example of an antecedent to well-being within the triad in particular, and the importance of developing resilience amongst close sport relationships as well as teams. Transfer mechanisms in particular. So the difference between an antecedent and a transfer mechanism is the antecedent is very much the factors that influences the collective well-being amongst the triad. And this transfer mechanisms highlighted here is almost the person-to-person transfer of well-being among the triad. And so what we identified is the importance of interpersonal coping, of emotional contagion, and also social appraising as kind of factors that can in turn lead to a transfer of well-being among the triad. We also noted that well-being is cyclic in nature, that there is, again, well-being can both be an antecedent and also an outcome of well-being, as was also highlighted by the sense of successful adjustment and development amongst the triad. Simultaneously, you can describe well-being and also evaluate well-being. So in turn, well-being is continuous in the sense that it can both influence in well-being and then also be a hallmark of the presence of well-being in particular, as this highlights. So some considerations as a result of some aspects of this work. So the research is one of the first to consider interpersonal well-being, psychological well-being among close sport relationships. I put in brackets sport, and in particular, I'm confident that I'm one of the first to look at well-being within close sport relationships, and up there with one of the first within general psychology to consider it also. So these findings are useful in many ways, in which I will outline in a slide or two's time, to optimize relationships to promote collective flourishing. Triadic interview methods from a research perspective have been seldom used within kind of research within sport and exercise psychology, so proves as a really useful way of bridging the gap between individual interviews and also focus groups, and instead looking more so at the interaction between close relationships. Some limitations in some ways, that whilst interviews again can facilitate what we call retrospective redescription, it can in turn, whilst that provides a lot of use, it can be limited in the sense of understanding the changing and dynamic nature of well-being. So that in turn has led to me kind of investigating in my current work beyond this work, the dynamic nature of well-being more longitudinally and over time. There is a need to understand well-being amongst different backgrounds, to understand the kind of tailored understanding of well-being in their close sport relationships, different demographics and backgrounds and sports, and so on and so forth is really important. There's also a need, as I mentioned at the start in my opening slide, to understanding different dimensions of well-being, and to understanding there's no one size fits all to understanding well-being in individuals and also close sport relationships. Are there other understandings of a good life out there that exist? And the question more pragmatically is, what dimensions do we draw on? I drew on hedonia and eudaimonia because it's fitted with the participants' descriptions and understandings of well-being. But is there more potential to be more tailored, to conceptually engineer well-being over time, and to allow people to be the experts of well-being in itself? So some research recommendations, with my paper within the sport context more confidently being one of the first to consider well-being within close sport relationships, I really hope that this in itself is a conceptual turn, so to speak. I really hope that now we start to realize the full potential of understanding well-being amongst close sport relationships, amongst groups and cliques more cynically within organizational sport psychology, and then understanding the idea of team well-being and what that could look like. Now, in order to really access that understanding, co-production is going to be very key. And that's something, again, that's having more coverage we're seeing within the sport and exercise psychology literature. Power as well. We've got an excellent talk following mine on the idea of power but especially within close sport relationships, how does power influence well-being experience collectively between horizontal relationships, people on the same level, but then also between mentors and their mentees in particular, between leaders and their followers? There is a lot to understand there, and understanding these power dynamics in particular. In understanding temporal methods as well, is there a need for us to explore not just the experience that influence well-being, but also the experiences that could influence well-being? What would happen if we're not only just using methods that get people's past experiences, but how we can start to access people's future experiences, their expectations for the future, their expectations for well-being in particular? So there's a lot that can be done there, in particular within the research realm. So some applied implications in particular that might be of interest. There is the idea within our work that the importance of psychological safety was established as an antecedent to well-being within close sport relationships. So there is the importance there of fostering opportunities for mutual sharing interventions that can enhance psychological safety amongst immediate work partnerships. For example, through using it before and after competition could help to maintain those open and honest channels of communication, and in turn enhance kind of well-being amongst close sport relationships. Appraisal-based interventions. So it was identified that social appraising was a key transfer mechanism of well-being. So this emphasizes the importance of using appraisal-based interventions with athletes, between athletes and practitioners, to work on their preparation, maybe between coaches and athletes to work on their preparation towards an important event. And then also particular with coaches as well when working with practitioners, and also maybe if you're brave enough to work with your athletes despite the power dynamic to develop your reflective practice. There's also the importance of self-care, and I know there's one or two people in the room who work in this space in particular within self-care. There is the importance of leaders and decision makers and coaches looking to see how you can develop and implement and monitor self-care plans with the intentions of putting close sport relationships at the heart of that. So developing self-care plans through the use of buddy systems to help build interpersonal resilience amongst dyads and triads, and then also using buddy systems or using spaces within a training block for emotional contagion to occur. So emotional contagion has positive and negative implications, but when managed rightly, can constructively influence well-being amongst close sport relationships, according to our work in particular. Here we go. So I want to kind of, with one or two metaphors to almost end on, if you bear with me with this, but one thing for us to really consider, for us as coaches, for us as practitioners, and for us as researchers, is to understand that psychological well-being is in itself a two-way mirror. So what is it with two-way mirrors? So within a two-way mirror, you can see yourself. So you can see your own experiences of well-being. You can see a reflection of yourself within a two-way mirror. You can also see the other people you're supporting. So in that regard, when people are supporting well-being, they often see themselves and their values that they hold on well-being, which again can be very useful when managed correctly through a range of reflective practices, through a range of acknowledging like your role and your background on interpreting people's well-being. But there's also an importance of acknowledging that, dare I say it, called biases, but also almost we call it your value judgments, so the values you hold on well-being and how they differ from the people you're supporting, from the performer, from the athlete or the support staff you are supporting. So it's with this in mind that we need to start to see the support of well-being as more of a two-way mirror. We need to understand how, like, our value judgments will influence the perception of other people's well-being. And with that in mind, we can start to close that gap that I kind of mentioned earlier. We're moving towards interpersonal understandings of well-being. we can really start to see how we can understand how the people we're supporting value well-being and what is important to them, both to how they're feeling, how they're doing, and to aligning with other dimensions of well-being. You know, what's important for them. How does their understanding of well-being over time, and in turn with that, how does our support of their well-being change over time? Because well-being's multifaceted, it's dynamic, it's complex, and it changes with the times. And so do we. We need to change with the times when we're supporting well-being, and we need to really understand the two-way influence of supporting well-being in particular. And really, again, as another important metaphor, the importance of moving from what about us or what about them to the idea of well-being is this is about us. Moving from experiences of individual well-being, where we often see that it is compromised in many ways. When you explore, for example, minoritized populations, as some of my other research has done, in understanding women coaches as onlys within their work, and how their individual well-being, when you ask them about well-being, is often compromised. They will often talk to you about how their well-being experiences are often compromised. But if we start to move towards the idea of how we can put a lens of the we in well-being, we're starting to explore how coaches and athletes, the coach-athlete relationship, the coach-practitioner relationship, or the client-consultant relationship can start to collectively harness well-being within their close partnerships. It suddenly goes from you're the only to you are not alone. And then from that to understanding more broadly the importance of team well-being. We're in this together, really kind of taking social identity approaches to well-being, but really feeding the strength of the idea that collective well-being, and this is more from the emotional literature, that collective emotions can amplify individual emotions. I would argue that in many ways the same would go for well-being. The sense of collective well-being, that we are in this together, will in turn amplify individual well-being. So this really emphasizes to me, and I hope you take away from this in your own practice, the importance of moving from the me to the we within well-being.
Richard, so yeah, just because we are over time, we're just gonna have to finish up there if that's okay,
Yeah.
Richard, if you don't mind.
Yeah,
I'm sure there'll be chances just to ask Richard some questions at another point, because we are just running over time, if that's all right. But thank you so much for that, though, Richard. That was really interesting. So thank you very much for that. And you know, there's time throughout the day, I'm sure, to ask Richard any questions. So so we'll just move on, if that's okay, now to Becky Panty. Penty, sorry, my bad. So Becky's going to be talking up next. So if Richard, if you could stop sharing your screen, and then Becky will have a go at sharing that. But thank you for that, Richard. Like I said, if what I'll do is, Becky, I will just put a 2-minute warning in the chat to you, if that's okay. So with no further ado, we'll head over to Becky's talk here, and I'm sure you can introduce it yourself.
Excellent. Thank you very much, Adam. Can you all see my screen at the moment? Perfect. Okay, I will make a start then. Thank you. Yes, so hi, I'm Becky Penty. I'm training to be registered as a sport and exercise psychologist through professional doctorate at the University of Portsmouth. And as part of that, I'm looking into how we can best support coaches and other practitioners working within sport and creating those environments which can really foster their well-being. So using, I guess, the aviation analogy of fitting your own oxygen mask before helping others, these coaches and others need to be supported in order to look after their own well-being, so they can support their athletes. So one possible avenue which my work is kind of looking to explore is how moving from a sort of a traditional biomedical model of mental health and well-being more towards a biopsychosocial model, and specifically really exploring the role of power and how that might be a useful lens to understanding threats to coaches' well-being in sport. And I'm doing this through using a sort of framework which asks 5 main questions, which tries to uncover how a person's lived experiences really affects their well-being. So within this short presentation, I'm just going to be spending the first 10 minutes just kind of running through the framework and the main questions it asks. And then hopefully we'll have time just for a short experimental sort of exercise, just using the story of a fictional athletics coach to really bring this kind of framework to life a little bit. So just moving on here. So within sport and exercise, the biomedical model still, I feel, quite sort of dominates quite a bit when talking about mental health and well-being. And I guess we can see this around a lot of the language, which sort of centers around symptoms, signs, diseases, and the focus very much on the individual. And this sort of medicalized language and labels, it potentially could sort of exuberate stigma and discrimination, almost resulting in people being quite fearful of seeking help and support. And so the claim that we often see is mental illness is like any other illness, sometimes potentially has the effect of sort of labeling an individual, and it can almost like deny their legitimacy of their feelings and suggest that there's something inherently wrong with them and their personality, and putting that focus on the individual rather perhaps in the sort of the wider society. So this biomedical model, which sort of suggests that health is defined by the absence of illness, doesn't necessarily mean that a coach has good well-being. And so in order to address this well-being in sport, I'm suggesting we sort of move up this ladder to this biopsychosocial model. And this framework I'm going to just talk you through it really allows us to do this because it ensures that all the elements, the biological, the psychological, and the social, they're all integrated when understanding and making sense of kind of our well-being and emotional or any emotional distress. So this framework here was the Power Threat Meaning Framework, and it was developed by the British Psychological Association as a conceptual sort of alternative to the biomedical diagnosis and medicalization of distress, and very much co-produced with people with lived experience. And it moves away from a biomedical model by, it changes the question of asking sort of what's wrong with you to what has happened to you. And that shift in the questioning just immediately takes the attention away from, I guess, this kind of supposedly sort of malfunctioning mind and the individual, and it shifts it to a wider social world. And so this model very much uses non-diagnostic language, and it seeks to understand people in their social and relational environments, seeing them as active sort of meaning making. And I guess if kind of as a summary, this model is sort of, it's a way of understanding distress and mental health it's been rooted very much in our circumstances rather than being a disease or pathology. Oh, yeah, and I guess so well-being, as I've sort of inferred, I'd say is dependent on not only a person's biology, but also their life circumstances. And so we will need to find a way to explore these lived experiences. And this Power Threat Meaning Framework, it really neatly kind of captures this by asking the question of what is your story? And it does, the question kind of pulls together 5, I guess, key kind of questions underneath it, and they're used to kind of structure your narrative or your story. I'm just going to briefly run through these 5 questions. So we're starting with power. So ask the question of what has happened to you. So this is quite a key question, and I guess in my eyes kind of what perhaps differentiates it from kind of mainstream formulations used within psychology. And there's often discussions of power sort of absent within theories and discussions about well-being. And this framework sees power, both positive and negative, as a central aspect of all our lives. It groups the power into 7 main sort of categories, I guess, which are biological, interpersonal, coercive, legal, social, cultural, economic, and I think perhaps most importantly in this context that we're talking about, it's kind of ideological. And so by very much asking the question, what has happened to you? It aims to try to kind of elicit these power inequalities that might be going on in people's lives that are really central to understanding their well-being. The next of these 5 key questions, it looks at threat. So it asks the question, how did it affect you? So individuals have certain core needs, and in order for to have good well-being, you need these core needs to be met. And anything which prevents these core needs being met could be seen as a threat. And there's no definitive list of core needs per se, but they could include things like feeling valued and feeling safe, having a sense of security and belonging, feel safe in your physical environment, and to feel valued in the role that you do. So just moving on to meaning, the third question. So ask the question, what sense did you make of it? What are the meaning of these experiences and situations for you? So I guess in a biomedical model, when you get diagnosis, it often sort of obscures personal meaning and limits kind of exploration of life's experiences and how you made sense of them. And this framework very much places a kind of central focus on meaning and narrative and personal experience. And then the fourth one is your threat response. So ask the question of, what did you do to survive? So what did you do to survive these negative operations of power? And in medical terminology, this would be your symptoms. So they'd be asking, what are your symptoms here? But instead, asking the question of, what did you do to survive? And these threat responses are very much shaped by our kind of what is socially acceptable or valued in society. And the framework makes a strong connection between trying to link these threats with the threat responses. Sorry, the threat response with the threats. And last but not least is the power resources. So what are your strengths? So for example, it might include people who care for you, or what certain aspects of your identity that you feel really good about, or the skills and values which are important to you. And knowing these strengths can really help the story and enable kind of ways forward. So that's just kind of outline of these 5 questions. So a bit of a whistle-stop tour, but what I'm intending next is I've got a bit of a case study here for you. So it's just a fictional case study of an athletics coach. Originally, I was intending to perhaps go into breakout rooms, but I don't think that's possible with how we're set up on here. So if everyone's happy, we'll just do it as a little bit of a group activity. So if I could just ask you to just take a couple of minutes just to read the case study of Coach Josephine there. And then we're going to see about which components of that case study might fit into our five key questions. And hopefully it'll bring this framework a little bit more to life. So I'll just give you a couple of minutes just to read through the case study, please. Okay, apologies. I never quite know when time is, but hopefully all giving you a bit of a chance to read that. And whether we could just, I know it's a bigger group, but does anybody want to have any suggestions to how answering any of those, picking out any of those, any aspects of that case study that might fit into any of those questions and start to answer some of the questions. Could perhaps start with power resources, because that's perhaps one of the a more kind of simple ones. Can anybody identify any power resources that the Josephine might be displaying there?
I'm thinking her family as well, her husband that she's talked about there would certainly be one.
Yeah, absolutely. That yeah, supportive family there, very much so. Yeah, thank you. You can, if everyone's, we don't need to pick in any particular one. It can go in any box, and often there is quite an overlap. So there's no actual order that you have to write these, answer these questions in. So you can kind of ask or answer them in any order. And also there is a little bit of overlap. So you might think, oh, does it go into the power one? Does it go into the threat? It could be applicable in many.
Would another power resource be if two of her team are medal contenders? That'd be quite a resource.
Yeah, absolutely. Yeah. And I hadn't thought about one. Yeah, that very much so. Yeah, I like that one. Yeah, thank you.
Hey, Becky. Oh, sorry, go on, Payal.
Sorry, yeah. I was just thinking about, is there any issues regarding managing personal and professional life where she is trying to contact athletes 24/7?
But yeah, absolutely. And it's, you might almost put that into a kind of, into this power, because she's expected, she feels that expectation to be available 24/7. And that's a real, yeah, what the culture or the ideological power, you could say. I think a hands up in the Lloyd is the.
Hey, Becky. Thanks for this. I think there's obviously a lot going on. I guess there's a few things that kind of strike out to me. One of them is just in terms of the power resources, not very clear with regards to whether there's anyone within that team of coaches that she could turn to for advice or support. Potentially there might be someone there. But then also, I guess what I'm quite interested in as well is there's this sort of almost a kind of paradox between eating and exercising regularly, but then also being diagnosed with an anxiety disorder. And I would suspect that obviously with regards to the anxiety disorder, there's going to be a lot of things contributing to that. And I think part of that could be the pressure of being on a short-term contract. So she's got the uncertainty of not knowing, you know, what her next job might be. Also the pressure of, you know, her athletes needing to medal, the expectation there, as well as all the other kind of stresses that you can imagine that come as a result of being in high performance. So I just thought that was quite an interesting sort of paradox.
Yeah, thank you very much, Lloyd. You raised some super interesting points there, really all very relevant. And I'm just gonna, I think we're just at times a little bit against us. So I'm just gonna these are just a few that and you've mentioned a lot of those already, that are potential ones that I had sort of thought up before. So I'm just gonna kind of, I guess, wrap it up there, but hopefully that's just giving you a tiny bit of kind of food for thought. So whether these, if there's kind of any takeaways that you can take from this, or whether you kind of recognize certain aspects of this in yourself or other colleagues, or even if it's something as small as perhaps it might be relevant to ask an athlete going forward to ask what's happened to them rather than necessarily what's wrong with them, that might be applicable in some cases. But I'm very happy to chat more at greater length with anybody about this and pick up a little bit further. So yeah, thank you very much all for listening, and hope you have a good rest of your day.
Thanks so much for that, Becky, and apologies for we're just kind of just wary of time there. So like I said, hopefully if there are any questions for Richard or Becky, there's time throughout the day to ask questions, because I think that's a really useful framework. So like I said, I'm just wary of time. So we've got Payal Gore, who's going to be doing our next talk. So if that's okay, Becky, if you stop sharing your screen, and then Payal, you can share yours.
Yeah.
So Payal, if we try and kind of wrap up at about 11 a.m., that would be great.
All right, no worries.
Okay, thanks. So over to you, Payal. Thank you.
Thank you. Hello, everyone. I hope you all are enjoying the session. Shortly introducing myself. I'm Payal Gore. I'm sports and exercise psychologist in training, and today I'm going to talk more about menstruation challenges in sports. What inspired me to talk or do more research on this topic was more from my personal experiences when I was training and was into sports. I suffered through a lot of menstruation cramps, irregularities that affected me physically, psychologically, and it put me through a lot of performance pressure. And when I was actually coming out and talking more with my coach, he always recommended me to go and have a look with a doctor, take some feedback from him, visit nutritionist, but never really said like, it can be psychological and it can be affecting you from a psychological perspective. And I remember one day going on the track, like being 21 years old and just crying out loud because I was not able to work out. It was not physical, but it was all through my mind, which was not supporting me. So yeah, like psychological point of view do matters and it's not been considered. However, when I was trying to do some literature review for my research, for my study, I found out not all athletes or not all women have sufficient information about menstruation cycle. So I figured out that 1 out of 4 women have insufficient knowledge, whereas almost half, or to be more precise, studies conducted showed that 48% of women are embarrassed to talk about it. I know that is a taboo topic in sports industry, but it's not only difficult for women athletes to talk about it with men, but also women. One of my participants explained that she was not comfortable to talk about it with her own coach, that she was female. However, I know it's really poor. We have noticed or witnessed that women rate of participation in compared to men has always been low. It is increasing, but there are so many obstacles that a woman athlete goes through in compared to men. One of the major is menstruation. When a woman goes through menstruation cycle and is competing in sports, there are various things that affect her. That can be irregular cycle, the late menstruation, volume, flow volume, and etc. There are also misconceptions related to menstruation and sports. It is seen that people think that practicing sports while you're menstruating can have adverse effect on your reproduction system. It can negatively affect your eating disorders. Of course, there are so many psychological symptoms as well, but it's all misconceptions if practiced properly and taken into consideration individuals' body routine and schedule. We can also always benefit from it. A good example has been set by Chelsea Football Club, the women's club. They, with the help of the sports smart app, they try to monitor women, every particular athlete's menstruation cycle, their eating habits, their sleeping habits, volume, flow volume, etc., and all the sports team together. The sports profession came up with a individualized plan for every athlete, which showed a really positive outcomes. With this study of mine, I tried to bridge the gap between the studies that have been already conducted and are going to be conducted in future. Most of the studies that have been conducted are physiological or biological in nature, and they are always or mostly qualitative. I tried to learn more about athletes from their own words. My study is more qualitative. It's qualitative in nature and trying to understand female athletes' perspective. I aim to assist coaches to design particular routines or understand athletes' well-being and help them by designing specific routines and help female athletes to have some self-awareness about themselves. So I'm going to quickly tell you that who was involved in my study. It was more about females. So, and to make it more generalized, I tried to have females from different nations. They, at the time of interview or from the study, 4 of them were competing and 4 of them were retired from sports. And they were from different sports, that was netball, basketball, gymnastics, swimming. athletics, hockey, and marathon. So after the intake process, they went through semi-structured Zoom interview calls. Later, I transcript these interviews and send them the transcripts over for the trustworthiness and to check if things are all right. And with the help of 6 steps analysis process by Brown and Clark, I came up with 5 major themes and 18 sub-themes that were generated from the slides. This is the slide that I'm going to spend talking more about because this is what the athlete shared. In this slide, I will be talking more about what they shared and their exact words as well. For examples, the major 5 themes were effects of menstruation, sportswear complication, impact of coach, athlete to coach journey, and coping up strategies that athletes develop with their experiences. So yes, we all know that menstruation are definitely going to have some effect on the athlete's journey. It can be physical, it can be psychological and biological, so on. But athletes shared that when they were actually practicing, going through daily movements that helped them to reduce the cramps, the menstrual cycle pain was reduced. One athlete also shared that she suffered from irregular cycle and lots of cramps during the pandemic period, and she blames it to not exercising regularly. Whereas so there are a few athletes who also shared that it is because of sports that they are having a regular menstrual cycle. They said that whilst they are competing, while they're in sports, just a minute, sorry. Oh, sorry, there we go. So while they're competing and when they are sports, they actually go through a good diet cycle. They have really good movements and exercises that helps them to have regular flow. Then athletes also shared that they felt really amazing energy. We have seen that there are so many Olympic athletes who have given the personal best when they were having menstruation cycles as well. So the athletes had amazing energy when they were having menstruation cycle as well. It's not always that they go through negative things. Basic facilities are sometimes not provided to the athletes. So I recommend every coach, athletes, and the people who are organizing sports to have at least basic hygiene facilities. Whereas we can also see that periods affect us in negative or a positive way. So it definitely has impact on us and also a psychological point of view. Athletes suffered through some emotions that were like having coordination, um, difficulty in decision making, balancing. Of course, I don't have to talk more about it, having mood swings. So this were a few effects that they had through when they were going through menstruation cycle and competing. Sportswear complication. It's not only about physical or psychological, it's also sometimes external. Athletes said that having particular type of sportswears also affect them a lot. Sometimes they don't have a choice over it. I remember one athlete sharing that she was not able to compete and she was feeling really bad for her teammate while they were participating in final matches of basketball. They had white jersey and one of the teammates started bleeding, which was clearly shown on her white bottoms. However, they had to continue with the game. So sportswear complications are always the major factor. They do go through different difficulties like having short bottoms, colors of it, length, fitting, and so on. The major complications were seen in sports of gymnastics, where they have really short bottoms and they struggle through sanitary protection preferences as well. Most of them go with tampons because of its nature and comfort. There are too many leakage issues that athletes have also went through. So they came up with the strategies of wearing multiple layers or wearing very comfy or loose clothing so that they can hide their bloated body. They get really body conscious. Whereas when we go to impact of coach plays a really important role in athlete's life. One athlete who I interviewed now is a sports physiotherapist shared that even though she prescribes rest or she prescribes some medicines or treatment to the athletes always tend to go back to the coach and take their advice, and ultimately that's the last word they follow or get influenced by. So I would like to highly tell all the coaches that you have a very major role to perform in sportsman's life. So the positive impact or your support matters a lot. The athletes or my participants who later turned into coach shared that because they have went through so many experiences themselves, they have tried to develop an understanding atmosphere, an open atmosphere for the athletes to talk openly about it. Specifically try to support female athletes who are in between the age of 10 to 13, because that's the generalized age where women hit puberty, to support them, to understand them. And they also recommended that keeping yourselves educated is something that helps a lot. Like you can always have have a quick read through few journal, have quick videos regarding menstruation cycles. That helps a lot. Coping up strategies. I do understand that it is not easy that you can come up with the coping up strategies, or by reading, it's really something that you can try to interpret in yourself. You have to have your own perspectives. So there are a few strategies that athletes came through after years of experience. The very first one was contraceptives. A few of them said that this was life-changing for them, having oral contraceptives or different forms of contraceptives, and trying to completely neglect menstruation cycle during major competitions helped them to focus. And it also not only stopped it physically, but also mentally. They felt that the emotions, the mood swings were way less comparative to the general time when they have menstruation cycle. So what this maintenance session, this is one of my best. So athletes, instead of trying to push themselves hard, try to just have a nice maintenance session where they try to maintain the performance, have some body movements, and just keep the body moving instead of forcing themselves to achieve another target. So this is my favorite. Instead of trying to just get more, just try to preserve or try to nourish what you have now. Gaining knowledge is something that was again important, and for self-awareness. Athletes try to have a positive outlook about the menstruation cycle by reflecting positive things instead of negative, keeping a positive journal, trying to work with instead of against it. They try to have like nourish it. They try to accept the fact that this is something that is going to be there with us forever. So why to go against it? And social support, like few athletes really said and emphasized on talking out loud was something that helped them. It's not always about working against it. It's also something just by sharing that they can solve a lot of problem and it can help them psychologically. So these are few of the insights. Moving on to the quick next slide. Yeah. So I highly recommend athletes to develop self-awareness, and then sports professions can develop a suitable routine for the athletes and monitor the routines to achieve positive performances. In future, like for female athletes, we can study their body issues, coach-athlete relationship, and sportswear complication. To conclude with, I will always say that menstruation has major impacts on women athletes' performance. The hormones do impact, women hormones do impact menstruation rate, metabolic rate, and other systems of women athletes. So in different phase of menstruation, there's going to be different performance levels. There's no scientific evidence that sports can reduce the period cramps. However, it can be reduced by exercising, which increases the endorphin levels, and menstruation cramps can be decreased. There are different kind of symptoms that athletes go through. It's not only physical, it's also emotional, psychological. And I can't emphasize enough on this thing that coach needs to be educated on this section to have better coach-athlete relationship and increase the well-being of athletes in future. Thank you so much. I hope I've done a good work there to cover things in between, yeah, like in time. If you have any questions, please contact me. That's my email ID if there's no enough time. And I have included my resources at the end of the slide.
Excellent. Thank you so much for that, Payal. That was a really interesting talk, and something slightly different from the previous talks before them. So thanks to all our speakers there, Richard, Becky, and then Payal at the end. So what we're going to do there is, just because I'm wary of time, we'll kind of wrap up the talks for this particular room. So if you could leave the breakout room and return to the main room, and then we're going to look to commence the next talks that are going to be just in kind of 3 minutes time. So we've got student talks. So if you go back to that main room, and then we'll direct you from there. But like I said, any questions for the speakers, please feel free to contact them. And if you wanted to contact Becky, or she's going to have to dash. So if you've got a question for Becky, then just feel free to email me or put that on the chat. Okay. All right. Thank you, guys.